The general perception of the public is that brain surgery is a very high-risk surgery, very destructive surgery. It is a high-risk surgery, but these risks are mitigated through the right techniques, right instruments, using high-tech equipment in surgery to ensure that surgery proceeds effectively and safely. Therefore, the risks are much lower than what is generally thought of or perceived when it comes to brain tumor surgery. The general risk when it comes to brain surgery typically depends where the tumor is and how big the tumor is. So generally, the risk involves include brain swelling, seizures, brain edema, hemorrhage, and weakness or numbness that is usually temporary. Right? With the techniques that we use nowadays, these risks are much lower than what is generally perceived. Surgery of the brain does not involve a very large opening, cracking open the skull and things like that. We don't do that. Surgery is done through a small opening, roughly about the size of 3 to 4 centimeters. Very special instruments are used during surgery to help target the tumor, to help us localize where the tumor is. And we use very fine instruments under a very high-powered microscope to help us look at the tumors, to help us save and work around normal brain matter in a very safe way to ensure that the tumor is removed completely without risking or damaging any of the normal surrounding tissue. And that is the standard of brain surgery in this current modern times. Patients have a misconception that when you come out of a brain surgery, half your skull will be missing. That is a misconception which I would like to correct, because the opening in the skull is small, and once the tumor is removed, the skull is replaced. We use specialized small plates and screws to hold the skull back together, and the opening is closed with sutures, and at the end of the day, after a couple of months, all you see is a single line. Hair will grow. You're not left without hair on the site of surgery. And surgery is typically done in an elective manner, so therefore, even before surgery, the necessary planning has taken place to ensure that surgery proceeds smoothly.